That's the ideal case scenario where we detect polyps before turning into cancers. Artificial intelligence in detecting colorectal cancer comes in different flavors. So at first we have image processing, where the AI algorithm processes the images and videos in live. So as we're doing the colonoscopy, the AI is actually integrated into the software to process the images and videos that we see. In that, they are able to detect certain polyps that can be missed by the human eye. Certain studies have showed that up to 50% of the polyps that could have been missed by the human eye can be detected by AI. And this has showed at least 10 to 15% increase in missed polyp detection rates. When it comes to risk factors, we look at them in two different flavors. So we have modifiable and non-modifiable risk factors. Certain modifiable risk factors include obesity, smoking, and certain ingestion of processed meat and processed foods. So the key factors when it comes to preventing colorectal cancer to the person themselves is preventing obesity, avoiding smoking and secondhand smoking at all costs, reducing weight, and also avoiding any kind of processed meat and intake of any processed vegetables. Unfortunately, there is about 60% of the cancers that we detect late. And that's in UAE data. So our goal is to reduce that number as much as possible. We would like to see the cancers when they're stage 1, if they are. So detecting those cancers is key to finding the solution to the patient's care. So in polyps that are benign and have a potential to turn into cancers, this is where AI comes. AI helps us detect those polyps before turning into cancers. And that comes into seeing the polyps themselves during colonoscopy, but also identifying the features of that polyp that could represent malignant potential, or in other words, cancer potential. So in detecting polyps early, we are preventing cancer from being diagnosed at a later stage. Diagnosing cancer at an earlier stage gives a higher response rate to treatment. So for stage 1 colorectal cancer, the response rate or the cure rate in the 5-year survival is about 90% or more. When it comes to stage 4 colorectal cancer, that number unfortunately goes down. We will utilize all platforms to get to the patient population here in UAE, get people to be aware of the risk factors that are associated with colorectal cancer, namely obesity, smoking, ingestion of processed meat. But also, we want to make people aware of their family history. So having this as a routine discussion or conversation between the patient and their family members about knowing whether they had a family history of colon cancer, rectal cancer, or such in the family, like polyps, is very important to know. So targeting social media, influencing campaigns, we have booths and pop-ups in the hospital and across the malls and shopping malls and in the community, directed at the patient population that we want. So people who are above the age of 40 are our goal. So anyone who's above the age of 40 needs to get their colonoscopy. And that's the ideal case scenario where we detect polyps before turning into cancers. In other ways, we can also be targeting through television, through news reporters and journalism. It's key to reaching all people living in the UAE.